It's Friday night, and no matter where you're watching us from, chances are this upcoming weekend is going to look much different than the same weekend last year. Things are opening back up in Los Angeles. Disneyland opened its gates today for the first time in 13 months. In Atlanta, the Braves announced a return to 100% capacity for games at their ballpark starting next week. Health officials say they are cautiously optimistic and encouraged by vaccination numbers.
With 100 million Americans fully vaccinated as of today, we continue to move ahead in our progress to end this pandemic.
That's about 30% of the population with at least some protection from coronavirus, according to the CDC. But that still leaves a huge chunk of people missing, specifically Black people. A survey taken just a few weeks ago by the Kaiser Family Foundation found 55% of Black respondents said they were either vaccinated or wanted to get the shot as soon as possible. But 24% said they were waiting to see how side effects played out or had other concerns. Those concerns are why we invited our first guest to join us tonight. Dr. Ebony Jade Hilton is a physician at the University of Virginia who made history back in 2013 as the first Black female anesthesiologist at the Medical University of South Carolina. Today, she makes it her mission to advocate for underserved and marginalized people. Ebony, thank you so much for joining us tonight.
Yeah, thank you for having me.
Of course. All right, so Black folks have been hit the hardest with COVID-19, as you're obviously aware of, and still not trusting the science behind the vaccine. Now, Doc, you're probably aware of some of the stats, but I want to read some of them for the viewers who may not know. But according to the Pew Research Center, just 42% of Black Americans say they would receive the vaccine, even though we are at an increased risk for getting sick and dying from COVID-19 compared to white Americans. CDC data shows that Black people are nearly 4 times as likely to be hospitalized and 3 times as likely to die from COVID-19 compared to white non-Hispanic people. And the Pew Research Center reports that 71% of Black Americans know someone who has been hospitalized or died as a result of having COVID-19. Now, Doc, I'm not going to lie. I was very positive about the vaccinations. I was ready to get one. I just didn't have much time. However, when I heard about the blood clots, when there was, news about these women who had received blood clots from the J&J vaccination, it gave me pause. And I think a lot of people feel that way. Can you just kind of go through the phases that this drug had to go through in order to get approved? Because I think people also are concerned with how fast it came about.
Right. And we can talk about the phases of clinical trials, of which the primary focus of clinical trials are to prove safety. But I think the bigger picture is to look at the context. How do we compare this vaccine to everyday life medications that we take daily? Women, right? When we're saying with this COVID vaccine that 6 women developed blood clots, that was 6 out of 6.8 million doses. So that's 1 in every million. When we're looking at birth control pills, for instance, that many women take daily, what we know is that for every million women who take birth control pills, between 500 and 1,000 of those women will develop blood clots. If we're looking at smokers, 1,000 in every million smokers will develop blood clots. And if we're looking at COVID-19 itself, 1 in every 6 persons, 1 in 6, will develop clots if you get infected with COVID-19. So yes, we know with every intervention there's a risk of side effects. But what we do with medicine is we say, if we know there are certain risk factors for persons developing these side effects, then we can tailor the medication to you. So maybe instead of you getting this Johnson & Johnson, you will get Pfizer or Moderna. But getting vaccinated is imperative for the Black and brown community.
Now, okay, so that's a great point to make. How do you decide which one to take?
Right. And it really depends on exactly what is your past medical history. What we know is the safety profile of all 3 of these vaccines overall. Again, we have to take into consideration at this point that 100 million Americans are fully vaccinated. That's just within the United States. We're not even talking about globally. So what we know is that for the vast majority of persons that are getting these vaccines, literally millions upon millions upon millions, that their outcomes have been just great, that they have, weathered the storm of, even if they had the headache and the fevers and the chills for those couple of days, of which I had 0 symptoms after my vaccination back in December. But that's the point, is that we have to think outside of our community and start thinking globally and seeing that these vaccines have proven their safety for literally hundreds of millions of persons around this world.
So what about those who say, okay, well, I don't have to necessarily take a vaccination. I'll just wait for herd immunity to kick in.
Right. And unfortunately, what we're seeing is that we are seeing some vaccine hesitancy starting to kick into play, which I've always thought we would. When we get to this crossroad of persons who are nervous about taking the vaccine and people that say, I definitely won't. What we've seen over the last couple of days is that we've had a decrease in overall vaccination by about 10%. Now, what does that mean for us reaching herd immunity? Well, at this point, we only have 30% of Americans fully vaccinated. And we have to get to 70 to 80% of Americans having this immunity before we can truly get this pandemic under control. So the longer it takes us to hit that mark, unfortunately, what we're going to see is like we're still seeing today, over 600 people died from COVID-19. And that's just the people who unfortunately passed away. We're not even talking about the long haulers, of which we see children now having symptoms for 6 to 9 months after they were infected. This is not going away. The consequences we don't know at this point. So protecting yourself and your family is going to be of utmost importance.
Well, what about when you hear stories about healthcare workers also being hesitant? I mean, they're in the medical profession, right? And if they're not willing to take any of the vaccinations, then why should we take any of them or have confidence in them?
Right. And what I tell people all the time is, healthcare workers, I'm a doctor. When I come home, I take off my white coat. I'm a Black woman. I carry my own set of doubts and concerns just like anyone else. But it comes down to each individual person to say, let me take a look at this and see whether or not the risk-benefit ratio actually works. And what we're seeing is that there are many physicians that are advocating, like I am, trying to urge people, because we see people in my ICU. They're not just old people. That's not the truth. They're not just people who are sick. That's also not the truth. We're seeing younger and younger people literally getting infected with COVID-19 and unfortunately passing away from this disease process. And to the point that at this time, we have over 40,000 new orphans in the United States of America. And although Black children only make up 13% of the children population, they make up 20% of those that are now newly orphaned. We have to get this thing under control because there's collateral damage that comes along with this war that COVID has created.
Absolutely. People have both real and imagined reasons not to get the vaccination, as the vaccine demand has basically plummeted as a result of these perceptions. Do you think that it's going to be difficult to change these perceptions at this point?
I think it will be difficult to change in the fact that many people don't seek, medical advice on things. They seek social media. And so it's going to make the works of persons like me and my colleagues even that much harder to say, let's get our faces out there and talk about this. Let's show people that, yes, this is my vaccination card and that I'm doing just great. Let's talk about the fact that my grandmother, who's 81 years old, was vaccinated. My mother, my sisters. I would not tell my families to do something. My family members who've had all 3 types of the vaccinations at this point, I wouldn't tell them to do something if I thought it could cost them their life. But what I do know is that getting infected with COVID-19 is far worse as far as outcomes than having the vaccination itself.
Now, Doc, is there a myth that you have heard that you want to talk about that I haven't gotten to in our conversation that you feel the viewers need to know?
Yeah, there's several myths, but one I think that, I could get into the 5G and I can get into the microchip, but I think that's for another day. One myth that I really want to tackle is the idea that it can be damaging to women in our fertility. Actually, what we're seeing is that you can actually, mothers, if you're contemplating whether or not I should be vaccinated, if you're pregnant right now or if you're breastfeeding, what we know is that your body is a beautiful protective machine, and that you literally, if you develop antibodies, those antibodies that can fight off COVID-19, those antibodies can literally travel to your child. And when your child is born, that child can be born what we call passive immunity. meaning that their body now already has immunity against COVID-19. Those antibodies can also be shown to be passed through breast milk. So it's a concept that you need to talk to with your OBGYN. Definitely have that conversation. But it does not, we're not seeing any signs at all. In fact, the CDC just released the results of pregnancy and no complications associated with women who were in their third trimester. So yeah, it's that's the one myth that I really want to tackle, because I know women, we do have a great responsibility when we're carrying life.
Yeah.
And so just to keep that concern.
Yes. No, that's great information. I didn't know that. So thank you for that. Dr. Ebony Jade Hilton, thank you for joining us tonight.
Yeah, thank you. Have a great one.